Afternoon, everybody, and welcome to our special Ahead of the Spread podcast. It's been a whirlwind of events over the past 24 hours, as Guam now has several persons under investigation for COVID-19, two from Wednesday, and then just two new cases that we confirmed with the American Medical Clinic. It was an elderly couple that recently traveled to Japan, and you can actually watch that interview streaming now on our social media pages. Now, we should stress, though, that there are absolutely no confirmed cases of the coronavirus on Guam. The World Health Organization, early this morning, while many of us were asleep, upgraded its assessment of the corona outbreak to a pandemic. And to help sort all of this out and to talk about pandemic response planning is Shawn Gumataotao. He is the former head of the Joint Information Center under the Camacho-Moylan and Camacho-Cruz administrations. That's from 2003 to 2011. And you actually, Shawn, you actually helped write the pandemic response plan for Guam, right?
That's right. Back in 2010, Sabrina, the Guam, as well as the rest of the U.S. states and territories, were asked by Health and Human Services to actually put together their pandemic plans as part of the national pandemic plan. There is a national pandemic plan that sits under the national response framework. So all of us were responsible to doing that. It was a process that took basically weeks and months before it was finally adopted. I think it was somewhere around mid 2010. Obviously, at the time, we were in a full response mode to the H1N1 outbreak or pandemic that was pretty much taking over the entire globe in terms of its cases and reports. So it was a response that we had to do. And my understanding was somewhere back in 2016, after the plan was adopted, it was put into the Guam Comprehensive Emergency Response Plan or Management Plan. And then it was updated back in 2016. So it's a standalone annex as part of our response plan for Guam and for all that we do. It's a response annex.
Is this something that we can apply today? Because I know there was the briefing last week that the governor held at, I think, at one of the hotels, announcing that they were going to be reviewing and possibly revising the pandemic response plan.
Yeah, you mean they can, and that's an important distinction. Now, they were in a conference for, I think it was 2 or 3 days, and plans just don't happen overnight. All the input that they would have taken from the doctors and the professionals that were in that room, we hope could lead to a modernization of that 2016 plan. And it's not too far off. I heard some media reports that there was no plan updated since 2010. But the 2016 plan was updated. So it gives them a chance to update, especially this important response to coronavirus.
Okay, well, obviously it hasn't been updated yet. So we're currently operating under the current one that we have. And so based on the current pandemic response plan, what should we be doing right now?
Well, and I think once there was the pandemic that was issued by the World Health Organization, obviously the Centers for Disease Control is also driving much of this from a federal standpoint. The territory will in turn have to respond. As soon as it's done, the actual pandemic response plan should be put in place. We haven't heard much yet from Adelup, and I think the whole community is waiting for them to respond accordingly. It would be in line with the plan. I know it was done just a couple of hours ago, but I think to coordinate such a big effort, obviously public health would be in the lead. It just takes a little bit of coordination. So we'll have to wait and see where Governor Leon Guerrero is and her administration is in response to the push at the designation of the pandemic by the World Health Organization.
And what exactly, if you can, just tell us what is in this pandemic response plan, the one that you helped draft?
Yeah, well, I mean, the one that was even updated in 2016, it gives the authorities of who will be running the plan. Obviously, the public health would be the lead, with the chief public health officer taking the helm. It gives all the kind of the authorities to bring folks over to support that effort. It gives guidance relative to our ports of entry and how the response would be done from there. Also, an important thing, Bree, is our first responders, not so much our guys like our firefighters and police officers, but those in clinics and at the hospital and GRMC and the private clinics, those are the people we're talking about, that making sure that they have the resources that they need to be able to respond if anyone happens to present with any of the symptoms of the coronavirus, or in this case, the exact virus that's spelled out by the World Health Organization in their pandemic call.
Mm-hmm. And you've had, as you mentioned earlier, experience as the head of the JIC in responding to H1N1, right? What should be, if you were in charge right now, how would you be handling the situation if you were the head of the JIC?
Well, I think and I have a lot of respect for the governor's office relative to how they are doing their communications. But I will tell you this: I think the biggest thing is at least daily briefings, kind of on what is the effort going on at public health in terms of their input with the CDC. I can tell you right now, Sabrina, that I'm fairly certain that public health is in close contact almost on a daily with the WHO and CDC. So just kind of the input on that. Obviously, with the president making his announcement a bit earlier today on some of the travel bans and some of the other items to mitigate the economy, it's important that that public health and the office of the governor get the information out to the people in a pretty timely manner. I would hope they would do so right before, obviously, the KUAM newscasts or in the publishing of the papers. But they should be doing that pretty regularly until this issue or effort it kind of goes or tamps down, and we kind of get some semblance of normalcy.
Yeah, and based on your experience, there was a conference or a seminar, or whatever you want to call it, by the Guam Medical Association last week. And during that conference, the governor, she gave her address and speech to the physicians and medical community. And one of the things that she mentioned was that if she were to declare an emergency, I believe, she would be in charge and take over all of the medical facilities on Guam. Is that what would happen from your understanding and your experience?
From my understanding, yes and no. In terms of, from a response point of view, it allows her to gain more access to more resources, to include the Guam National Guard. Remember, they have the CST teams that are over there at the National Guard. They can use them to be able to help, obviously, the lead agency, which would be public health. They'll be able to avail themselves of maybe facilities. Obviously, we've been hearing talk about the SNU up in Barrigada Heights as a possible place for a quarantine. They can use those things. I mean, they have a lot of different facilities that they could use to do that, depending on how many people might need that kind of service. But they already have that authority, and so obviously, when she says she can do it, yes. But also the chief public health officer, believe it or not, under statute has quite a bit of powers to be able to. It almost kind of trumps the governor in terms of moving resources, closing facilities, moving people around. The chief public health officer has a lot of power, especially in a state of emergency. But hopefully, the two can work together to be able to respond, and it's a response that doesn't negatively impact what we do as a community. And obviously, we're just trying to go about our normal lives, and hopefully, it doesn't get in the way of what we do.
Mm-hmm. Yeah, as I mentioned earlier before we got into the interview, there are four PUIs, and you're now on the outside, kind of looking in, right? Not in the JIC position, and I'm sure you're still in communication with several people from the previous administration, several people currently. What is your assessment of the response and the preparedness and the messaging?
Well, I guess from a messaging point of view, I think I would have handled it a little bit differently. Obviously, we always have to think about our greater community, and I think we should be taking a little bit of a lesson from what we're seeing on the U.S. mainland with the administration, because they guide the actual response effort. So it should be in line regardless of political party, because obviously just because you're a certain party, this pandemic or the coronavirus is not going to discriminate once you're infected. Mm-hmm. So everyone needs to be kind of, American. Everyone needs to be in line. And I think that's one thing that the current administration could be looking at with what they're doing. Also, I think they've been relying heavily on the use of the epidemiologist, and they've been on your program, and there's nothing wrong with that. I think that's important, but the results of the epidemiologists are going to be way more important in 3, 6 months, 12 months from now on the impacts to Guam. Obviously, we don't have a large amount of folks who do, like, we don't have very many pulmonologists or those who use, this is a respiratory, basically virus. So getting those people involved, and you see them all the time, because you and I, if we go to our regular checkups, we talk to our doctors and they tell us, hey, you can get a flu shot, be mindful of these certain things, but that we have to kind of, messaging wise, we should kind of make it a little bit more to Joe public so that they understand it and they're not panicking. Because early on, if you recall back in early February, there was people presenting the worried well. They were presenting at GMH and public health saying, oh, I have the coronavirus. Did you go to China? No, but I might have it. So we just didn't do enough early on to be able to communicate to them that, hey, and by the way, that's one of the results of this type of communication, is you're going to get a bunch of worried well going into GMH or to clinic saying, I might have it, but they never left maybe their village. They never left the island. They never went into those countries that are affected by the coronavirus at all.
I did want to switch gears real quickly and ask your opinion about the Team Guam plan, and that's the economic, I think, recovery plan that was ruled out. Was it earlier this week by yes, the administration? Did you get a chance to look at that, and do you have a response to that?
Absolutely. As a small business, I think we are doing what we're doing. We're going to continue our work. Obviously, we have to continue to be part of this economy, and I'm not for certain that especially the economic outlines, the pushback of the taxes without any kind of rollbacks and I'm not really sure if it's really going to achieve it, because if you have a $30 million loss in total revenues, especially from our tourism industry, by just pushing back, not paying taxes for a couple of months or 90 days, it's still going to be there. I think we should be trying to present ourselves as a safe destination. Obviously, the tourism industry is our #1 industry. The military, have they changed their posture in the last 3 weeks? They have not. I mean, if you go down to Tumon, you still see people here on either deployments, they're here on exercises. So we know that the two major engines of our economy are still working. So in terms of that plan, I really think there has to be across the board. We did it in our administration back many moons ago. We had to cut spending. So if you're going to have to cut, I think we're seeing it in the CNMI. We're seeing it in states all across the country where they're having to reduce their current. I mean, we're already 3/4 of the year in. Is it one more quarter to go? So we're going to have to begin cutting back. We can't continue to keep spending on the normal clip, especially with the loss of tourism revenue that we're seeing across the board. And that's not just tourism, Bree. It's also the airports seeing the loss, the airlines, all of the industries relative to it are all impacted by what's happening. And I think that the plan is a little, there's got to be more in there. I think most of the communities maybe hoping they'll add some more over the next couple of days and weeks.
All right. Any final comments, Shawn?
Well, I would tell you, Sabrina, I would hope that the community remains vigilant. I think we shouldn't, as a community, especially, and I can say it as a private citizen and a person who also is very concerned about this issue, is we just got to continue to use our heads, use our common sense, continue to wash our hands, continue to encourage our families to do the same. We can't live in fear over this particular pandemic, because believe it or not, people in our families, both yours and mine, we've probably seen them, and friends who have passed away from just the regular flu. And so if we think of it in such a term that's so different, obviously we're not going to be living our lives that we should be, and it should be a little bit more normal. And we're hoping that it remains that way. And again, I would encourage those who are listening to this are going to do the same. And hey, just be vigilant, wash your hands, and obviously be mindful when you're out there.
Anyway.
It's so crazy that we're talking about washing hands in 2020. It's a thing that's a part of what we do. And I know in schools, I'm hearing about it from my kids' schools. There's a lot of advisories going out. Mm-hmm. I mean, the basic one is telling everybody just to wash your hands.
Yeah.
And so we're hoping that that they'll just take heed And again, if they're sick, stay home. Obviously, it's a good push that they're canceling some of the events, the bigger events here, out of an overabundance of caution. And maybe we'll get back to some normalcy in the next 3 to 6 months.
All right. Thank you so much, Shawn. Shawn Gumataotao, he was the former head of the Joint Information Center from 2003 to 2011 under the Camacho-Moylan and Camacho-Cruz administration. And he also helped craft the last pandemic response plan for Guam, which is still in effect back in 2010. Thanks, Shawn. Earlier today, I did speak with Dr. Shieh. He is the president of the Guam Medical Association. As I mentioned with Shawn earlier, the governor did speak before the GMA last week, so I got a chance to talk to him about his reaction to the address and the response thus far from the government of Guam.
Yeah.
Okay, just in time for the conference, right? I want to ask you, what did you think about the conference? The governor's address.
I didn't hear it. Sorry.
Really? The one at the conference at the GMA.
Oh, the GMA conference address. Yeah. Well, I thought it was good. We thank the governor for her time. I think it was in generality. We kind of knew what was being said, but I think overall, I think it was good content. But I think towards the end there, I think, short of declaring martial law, I think the better answer would probably be said that, hey, we should work together with the community clinics rather than saying we're going to take over all the clinics or your property, etc. Those kind of stuff doesn't really work. And especially with Gov Guam, if they really want the community to work together, we need to make sure that we ensure that we have a collaboration rather than one-way street.
Mm-hmm. So since then, or throughout this whole COVID situation, has there been this partnership with the government of Guam?
I think it's better. I think I'm communicating with public health more. I spoke with Dr. Ann and CDC, Dr. Hancock this morning, and we seem to be there seems to be more cooperation on both sides. And I know we have a conference that's coming up, but I know there's talks that, hey, if there's a positive case, then we may go ahead and postpone that conference. But we'll see what happens. The key is to get the word out, the education, to making sure that people in Guam is safe. And I'm in Hawaii right now. It seems pretty normal here, and there's about two positive cases here. It's going to get more as time goes by, but the message that's being given out, even in the media, is also that the flu is worse and coronavirus is not as bad. But if it's not as bad, then why do we have to ask ourselves, why are we quarantining people if it's not as bad?
Mm-hmm. And we did post that story yesterday about the 2 PUIs, and then just today we confirmed with the American Medical Clinic of an additional 2 new PUIs. And so I wanted to ask you about the comments you made on social media last night, saying that it's interesting that a new hospital can't isolate a PUI and had to send a patient to GMH that is over 50 years old and not accredited to isolate and treat. And you said something doesn't make sense. What did you mean by that?
Yeah, it doesn't make sense, because, with the hospital GMA has been criticized for being old, and even the governor said that it's being old, and things are leaking. But why would you want to send someone there? And if you read, I think a week or 2 weeks ago, that actually the administrator said that she preferred not to have corona cases being isolated over at GMH because of the lack of rooms, and also because just because it's an old facility. I think better planning would be not to move the person. If you have a person with PUI and checked into any of the hospital, for example, if someone goes to Naval Hospital and he's a PUI, would you want to send the person from Naval Hospital to GMH? I would think you isolate that person right there and then, rather than transporting and exposing people in the ambulance and exposing people in the emergency room and getting more exposure out into the community. Isolate them right away at whatever facility you're at, and especially the hospital. You isolate them at the hospital if they're really, really sick.
Has there been any communication with the Guam Medical Association, as far as any of the other members with the government or public health or ADALOOP in how they're going to respond to COVID?
Well, I think we reached out to ADALOOP, and I think they're busy, but so we reached out to public health. I think public health's been more responsive since we approached them and being more proactive. So I think they actually are responding now rather than before, where we're sort of isolated. and they're sort of doing their own thing. But we don't want them do their own thing. We do our own thing. We want to make sure that we collaborate, we work together, because Guam is small, and we want to make sure that we protect a fragile environment and a fragile healthcare system on island.
Mm-hmm. And if you could break down for us the criteria that's used to determine when a person can be classified as a PUI.
Well, I think right now it's changing for Guam. Now that the United States has given the territories and each of the states their own power to create their own criteria, I think public health is coming out today with our own Guam's criteria. Before, it used to be you have to travel to China, or you have to come in contact with someone who actually been confirmed positive. Well, the criticism with that across the country is over the last 2-3 weeks, or 2-3 weeks ago, that the United States only tested less than 500 people. And that's why the percentage death rate is so much higher than the flu. Is the denominator. The denominator has to change, because if we don't change the denominator, the death rate keeps going up, and it becomes more serious when you look at the data. In order to get good data, you have to test. And that's the criticism, is that we're not testing enough. And I think they got that message. So hopefully our criteria that's being formulated now allows the provider at the clinics to actually refer and get tested.
Mm-hmm. So public health is coming up with this new criteria today?
I think so, yeah. When I talked to them this morning, I think they're coming out with Guam's own criteria to actually consider a person who is PUI. Each individual country has their own criteria as well. So we have to kind of watch as things go. And things are moving rather quickly now, because the United States are starting to test. You're going to see more positive tests coming out.
Mm-hmm. And now that we're able to do testing on Guam, that's what you're thinking, that we're going to see more cases. Or we don't have a confirmed case right now, but
well, you have to test enough. You have to test enough, because you have people doing testing, but you have to test enough cases to get the positive. If you really think about it, we're kind of behind the ball game, because so many flights have been coming in and out from Korea, Japan, Philippines, and China by way of Tokyo. So if it's in a community, it's out there. But remember, majority of the people who gets coronavirus don't get very sick. So those are the people that we want to make sure that, hey, don't come to the doctor's clinic if you're not too sick. And if you are really, really sick, call your doctor first and get the clearance before you go into the clinic and start contaminating everyone in the clinic. So I think the word that we want to get out there is to make sure you protect your doctors and your nurses as well, because we want to make sure that we want to protect our healthcare providers. Because if we quarantine one of our healthcare providers, that's thousands of patients that they won't be able to see.
Mm-hmm. Are healthcare providers from your industry, are they prepared? Do they have the necessary PPEs?
I don't think we are, because if you ask them, how do you quarantine somebody, or how do you assess somebody who has the virus? And PPE suits are good, but we don't have those. I mean, there's a shortage of them. And that was the question that was addressed to the governor at the conference. I think Dr. Akimoto or Dr.
Akimoto
actually that asked that, hey, we lack of PPEs and protective equipment for our clinics. Can you help us provide those equipment and protective equipment? But the answer that we got was something different. The answer that we got was, if declare an emergency, that she can take over whatever items she wants. Maybe that's the way to get the items. I don't know if she could actually take over the Naval Hospital. I haven't heard that part, but it would be interesting to see if the governor can actually take over the Naval Hospital, which is good, because we can actually use that hospital.
Mm-hmm. All right, Dr. Shieh. How would you rate the government's preparation and response to date?
Rate them like from 1 to 10.
Sure, one being terrible and 10 being outstanding.
Maybe 5. I would say 5, and it's simply because I think we're kind of behind the ball game as far as checking and screening, etc. I think we should have done it earlier. But then again, there's a lot of pressure from the tourism industry that we have to look at too. I know the Guam
you were
Chamber
mentioning
and the GVB is putting a lot of pressure, and I can understand where they're coming from. I can understand, because the bottom line for Guam is tourism. But then again, I've always said that in order to protect tourism, we have to protect our healthcare system. If we have a good, solid healthcare system, the tourism is going to be strong. And you have a lot of local people on Guam that's there, and they're your permanent tourists, and that's always emphasized that.
Mhm. And you were breaking up for a portion of your response. If you could just go
Yeah.
back through that, you rated them a 5 because.
Well, I rated 5 because I think we're behind the ball game. I think we should have done the screening much earlier, and I think we should have done more testing. You don't need a kit to really do the test. I think you can draw blood and send a sample to Atlanta and CDC, or we should have put more pressure on CDC to actually provide us with more of the expedited equipment that we need to protect ourselves.
Mhm. But you say we could do the testing, but wouldn't that be based on the criteria?
That's it,
And
exactly.
you
And I
know,
think we should have pushed CDC to be more lenient on the criteria. The denominator of you have to travel through China or Wuhan, China, or come in contact with somebody with a confirmed case. If you don't test, how do you know you come in contact with someone who is confirmed case? You can't. So that's the denominator that didn't change was about 2 months, and I think that's the delay. And because of that delay, I think that it's already out of China. So people from China, even though you don't have direct flights to Guam, you can actually go through Tokyo. And I know recently they decreased the amount of flights, but what's done is already done. So if it's on Guam, I think we just have to deal with it the best we can.
and real quickly, the Guam Medical Association, they're hosting a conference this weekend. Can you tell
Yeah,
us
we're
about that?
hosting a conference. Yeah, international conference this weekend, and we're actually going to have live telecast from different countries. But the talk this morning was the doctors are sort of afraid, and Dr. Berg himself actually said that he was afraid that hey, maybe we shouldn't gather because if we get sick, then everybody gets sick. So, and based on Dr. Berg and his recommendations, and maybe we should postpone the meeting. And I'm taking that under consideration. And I think if we have a positive case within the next 24 hours, 48 hours, I think we probably will. But I think we all need to be just very careful as we go out there. But, we can seclude ourselves. I mean, if that's the case, then don't go out to any restaurant. We're not talking about socialize. We're talking about educational events here.
Mhm.
Are the schools going to close because you have cafeterias, you have school that's full of kids? Are they going to close up? But I think we're talking about what Dr. Berg was saying is because of the doctors just being out there and we're being exposed. And because we have a lack of doctors on Guam, that we definitely have to protect ourselves.
All right. Well, we thank you so much, Dr. Shieh, for taking time to speak with us.
Okay, and this is pretty cool. First time I'm doing this.
Well, we can do more if you like.
I'll be back tomorrow night.
Okay.
All
Take
right,
care.
I'll see you later.
All right.
Bye-bye.
Okay.
Aloha.
Bye. Aloha. And that is it for our very first Stay Ahead of the Spread podcast. We want to remind everybody just to please stay calm, practice good hygiene, and there are no confirmed cases of the coronavirus on Guam from all of us at KUAM. Thanks for watching.